thank you all to invited us to talk about this important issue. So I'll just add a little bit more about me that you can read even later on. I am consumer advocate and member of Cochrane Consumer Network and helping Cochrane develop consumer network as well. I'm also participant on one randomized control trial, and as MD and researcher I'm visiting sciences of Medils and of Echel. I'd like to remind you again what I said last time about that we are obliged, even when we do research, to follow Hippocrates' oath that the health of my patient will be my first consideration. So can we have the first poll now, please? Thank you very much. That's quite similar to what we had last time, isn't it? Thank you very much for answering it. So let's continue with our presentation. So let me remind you that the open access to trial data is important because, and we are studying prospective trial registration and public disclosure of results, including all data and related documents. It includes studying culture, initiatives, actions, and we expect a shift of paradigm to have more studies done using data than collecting new data. And we are trying to define how, what, and where, and how to use it. So today, in this part, we shall present the IMPACT Observatory of ongoing transition in clinical research regarding data. That's an epidemiological study. And improving access to clinical trial data is actually spelling of that IMPACT acronym. And it was funded by NUFEPRO, which is Marie Curie and Croatian government, and now it's hosted by Medals, and also it's in sometimes I work from Canada. Because I live between two places. So last time I gave very detailed definition of observatories. So this time I will give you just a very short one to remind you. Observatories are natural experiments, epidemiological studies that assess the impact of one or several interventions that are not controlled by the researcher and to inform the process and indicate trends. So in our case, to apply it to IMPACT Observatory, there are multiple players that act on clinical trial data sharing with a consequent impact on clinical trial enterprise. And that doesn't include only how studies are done or trials, but also how systematic reviews, evidence creation is done. So IMPACT Observatory then goes stage by stage to get there. So it's to identify changes of culture, perception, policies and practice, and dynamics and roles of players, assess barriers, gaps and opportunities, indicates trends, potential development, and suggest improvements. And then finally, we hope impact the transition of data sharing and of research. So last time I gave the detailed historical description, so I won't go into details now, but I'm leaving this slide for you to see the inspiration came from various places, particularly starting with New York Attorney General versus Glaxo and consequent snowball effect created by journal editors ICMG, and that's when we are now there, and I continued it after the fellowship at between Canada and Croatia with Medals. So IMPACT Observatory aims to assess transitional data sharing, increase reliability of evidence, research integrity and quality of studies, aims to therefore contribute to speeding knowledge creation, overcoming research waste, avoiding unnecessary and even harmful trials, regaining public trust, and indicate trends in form and impact transition. And thus, we expect it would contribute to health, of course. So there are changes that we measure, we said, over time in order to calculate that trend and what's happening. So we are measuring changes of culture of researchers regarding data sharing and research of existing data. How much more is that done? Then policies of all the players, then standards, development and changes of standards, initiatives and projects regarding access to data, changes of data repositories, and of course of registries of repositories. So IMPACT Observatory, like many studies, has its challenges. One of them, major one, is that it's very complex. There are numerous players and we have to catch their culture. actions and interactions, and build and maintain network and connect the dots. So issues and players are nicely illustrated by showing you how many players are really influencing it. Anything starting with anywhere, journal editors, researchers, consumers, pharmaceutical industry, publishers, regulators, media, funders, academia, patient groups, and librarians are moving into that big time. So then what we study is culture, infrastructure, policy access, preservation, know-how, standards, findability, and citability. So we then, over time, we developed this at the beginning of the thinking that we should look into that. We tried to identify what are the major barriers of preventing sharing of data or publicly sharing of data. And these were the barriers we defined like 2012. And by now, the change did happen, and some of these barriers are smaller. If I knew how to, I asked Nevena next time to do the potholes, which we are rich of in Montreal after the winter, but barriers are also helpful. So as you can see, they do go down. We are dealing with addressing those challenges and barriers, but they're still there. So the culture incentives and academic credit is sort of interlinked to academic researchers. Citability was a big problem, but now it's done with persistent identifier. Availability is also much gone in a way, but findability is still not easy. Pre-publication was fear, but now it's dealt with. Editors emphasized many times, but we still have to deal with resources needed and policies that would help. Privacy and anonymization, we had a quick chat. You'll see what Khaled will tell us. I believe that gradually it should be not seen as barrier, but as something we need to do. Then, of course, we have then two big barriers at the end are standards of data, how you package and prepare, and standards of repositories, which are still not done. So potential development then is of the IMPACT Observatory, just to round up the study. And I want to mention, some people asked me to give more about methodology. So if this is not enough, we published a paper, and you can ask and I can give you more information which won't be able to fit in this 1 hour. So observatory hopefully will evolve in a long-term observatory that will continue assessing data opening until data is open, and thus contributes to data opening access process and change of the research paradigm. And refining the methodology of observatory, because for each area you have to do some adaptation, and then hopefully, that's my dream, expand it to other areas to test and adapt methodology needed. So the potential next step is that I'm discussing with Medals is to start IMPACT Observatory of Aging Research. But there is also potential spin-off that I've been asked by somebody in the meantime, and that would be pointed to. We thought it would be important to identify analyzable IPD-based data sets in various repositories, and then test reusability or reanalysis of such data on the same topic from several repositories, because there is a heterogeneity, unfortunately, and assess the extent data are shared and reused, and assess the add-on value of IPD meta-analysis as compared to whatever systematic review was, etc. And thus contribute to standards development, be included when the standards are, international standards are being developed. Many standards are happening, but we need to have something accepted internationally, and change of paradigm of research. So we can ask, what is IMPACT Observatory? I used to say it was a tool, but maybe it's a hub or virtual, it's definitely a virtual organization, assessing and informing about opening of clinical trial data and related changes of research. And it's also aiming at contributing to a change of paradigm due to data sharing changes. Some people might ask, who is IMPACT Observatory? Well, it's a multi-nodal network and team of people or groups of people with good ideas and goodwill. And this study with Ottawa Group went through the IMPACT initiative and then expanded further. So we are actually anyone interested in increasing access to clinical trial data. So the methodology then includes actually a composition of several studies that build into IMPACT Observatory to define those barriers, opportunities, and gaps. That's what I meant when I said at the beginning, connecting the dots. What we learn from these individual studies, we have to connect. And then we publicly release findings in order to indicate trends and impact transition. And findings are now publicly available on the Medals website. Then Neufeld Pro also put some stuff on their site, but we are also using Figshare. So network is the beginning. And we showed it on our poster of developing, which we showed at the Cochrane Colloquium in Vienna. That network actually is a big group of people from all over the world with various contributions to the IMPACT Observatory. And then there is an open door between network and team, and people from network sometimes get to team, help do something, and go back to network just to support. And that's how we move forward. That's very important because all of this is done pro bono practically now, especially now. So the next part of methodology, or the next type of research, is a scoping review, which we described at length last time. So I won't go there. It's basically scanning and mapping literature. And it has many advantages compared to more strict systematic review styles. It's more flexible, but it has challenges, which are similar to other areas, which are due to language and terms and translations. It's not just, Nadia, difficult to pronounce my name, but let's say translations of the word evidence and even statistical code proved to be difficult when we did some surveys and in the life. There are no specific mesh terms in PubMed when we are looking for literature, and it's difficult to catch up and follow media and social media. But scoping review helped us define the baseline in 2000, which defined all the needed attributes were there, which we showed last time. And we continued it, and we are following what's new happening since 2000, which is the baseline. And then we go to the access. We pointed to the access, restricted and open, and all these areas in between. And it's been big discussion these days how to do gradual access and between those two areas, which are not really totally divided. So the surveys and interviews are, I just want to mention that the scoping review is very much helped by network, because they would sometimes send us something they learned, they've done, or they've seen, so we would be informed. The surveys and interviews are two different types, but we put them together here because not just because interviews are still going on and we don't have many results, but also because they're interlinked, they're mutually informing, because both of them specifically study directly contacting players, their culture, perception, opinions, and positions in practice. So we analyzed, for the sake of one of the team members at the time, she needed it for her buck. So we analyzed one interview for each of 6 constituencies of players, which are academia, consumer who was also a study participant, editor, funder, pharma, and researcher. So what we could extract as they all send the key messages about data sharing is that it should be shared, but that data opening will take place gradually, that international standards are essential, both for anonymization and to prepare data, that they should be developed by an international, independent, trustworthy organization or coordinated by them, such as WHO, and that data should be in the format that would enable their future use, and the consumer specified they should be shared electronically on the internet. And there was a notion that data from publicly funded studies should be made publicly available. So I'll give you just one flavor of interviews regarding change of culture. The interviewee from academia said, so we've been doing interesting exercise, I have to go back. Interesting exercise in ethics committees. We have been telling researchers that all their data is confidential, that they must not give it away, and they have to keep it secure and safe. And now we are trying to turn it around. And then she made a longer explanation, but basically, and make it data publicly available. So we expect a lot from interviews to learn about details and change. Surveys of players, we've done so far several surveys using internet or web-based surveys, Monkey and Qualtrics, and we interviewed journal editors, members of the World Association of Medical Editors twice, clinical trialists, consumers and patient groups. We interviewed members of Cochrane Consumer Network, of Italian patient and citizen organizations, and Croatian Cochrane partner organizations. So we are now learning about how they fare. So one question that I compared at least 3 groups was we asked them what should be made publicly available. And this is how they responded. So editors, CCNet, consumers and trialists. And you can see that more or less they quite similarly answer. We didn't calculate statistics differences, but apparently consumers are quite open to have data shared, and many of that from summary protocol, summary results or results, etc. And the IPD is lower in all 3 groups than what I was hoping to. It's below 50% of them believed. So we asked editors, trialists, in trialist survey, that's the culture we are particularly following. We asked them, did they share IPDs from their finished studies except for the current study? And they said no, more than half of them didn't. 11% did, and 35% didn't, but they would do it upon request. So that was in the trial list of 2015. So then we asked consumers, what needs to be shared, what is needed for sharing the raw data, and they pointed to anonymization and standards, and data preparation methods also. And then we asked them, okay, if it's standards, which standards? And they thought the international standards would be very helpful. We asked them also who should develop them, and they said WHO, but we already discussed it, so I won't show you that. So then we compared Italian and Croatian groups, which are more similar because we assume that Cochrane consumers are more educated. And so Italian groups, when we asked them what they think would be benefits of data sharing, they said it would reduce unnecessary research and it would enable studying adverse reactions. And Croatians said they would like to know, and there would be assessment and the progress of science. So these are the posters you can explore at your leisure. Then we now have poll number 2. Thank you very much. So that's what we might have assumed, that very interesting that we have some study participants. So let me go to the anonymization now, and that would be that, let's say, trialists highly rated the need to anonymize in order to share. In the parentheses, it's how many of them were responders. The same highly rated by consumers from Cochrane and Italian groups. And Italian groups also identified re-identification considered one of the large risks of that. Doing the sharing of data.